Hi, my name is Mike Siatkowski, and I'm a pediatric and neuro-ophthalmologist from the McGee Institute in Oklahoma City, Oklahoma. I first heard about OMIC 20 years ago when I was actually working at a different institution. So I actually have the ability to compare OMIC with my prior carrier. And I have to tell you, I've been so impressed with how excellent OMIC has been. Their customer service is wonderful. If you have a question that you email them or call somebody with, they're very attentive, they answer right away, they're extraordinarily helpful and kind. OMIC has also been very, very involved in the educational aspect as well. Through the APOS meetings, as program director and as attendee, I have been able to hear OMIC present on numerous issues in pediatric risk management over 10 times through the last decade. They're also great with all their insureds. They work with state societies, local societies. They've come to our department to teach our faculty and our residents. It's been a tremendous experience. In fact, they have now over 50 cooperative ventures with state and subspecialty societies across the country. So it's really nice to know that someone that I'm paying insurance premiums to supports education and supports the different professional societies to which I belong. In the realm of pediatrics, OMIC is extraordinarily well known for the efforts they've made in improving the care and enhancing the safety net for infants with retinopathy of prematurity. I was an early adopter of the safety net plan to help NICUs across the country and different treating ophthalmologists coordinate care in the hospital, as well as the difficult times of handover during discharge or transfers. OMIC has worked with our hospital and our pediatric ophthalmology group, as well as with many across the country, in order to develop a protocol and in order to help them enforce this protocol as it was necessary. In fact, if it weren't for the work of OMIC, I'm not even sure that many hospitals would have hired an ROP coordinator, which is an essential component of this strategy here. Obviously, ROP is a very evolving entity in terms of diagnosis and treatment. Some of the new things on the field now are the use of intravitreal injections to treat the disease and telemedicine or remote screening for diagnosis. OMIC has called on many of the experts in the field to get their advice as they develop protocols and recommendations to handle both of these situations. And I think that's one of the things that makes it such a successful company, is that they have excellent communication and cooperation with their insureds and also experts in the field who may not be their insureds. They want to do the best thing, they want to stay up to date, and they want to make it practical and appropriate for patients and physicians alike. The staff, as I said before, is wonderful, and I think most of us who are insured by OMIC have developed a lot of great relationships with different people on the OMIC team. As I said, they're very friendly, they're approachable, they're non-judgmental when you have a question or a concern or a problem. And in fact, I think most of us feel like the people at OMIC are our friends and colleagues as well. I'm sure I'm not alone in these sentiments. We all have good feelings about OMIC and great confidence in the work that they do.